Hi there, my name is Dr. Nicole Siegfried. I'm a licensed clinical psychologist. I hope you find this video helpful.
Many antidepressants have known interactions with other medications and foods. They can also present greater risks for people with certain medical conditions. This is why it's important to go over potential interactions with your prescriber before you start taking a new medication. Make sure they have an accurate picture of your current and past medical history. You may have heard that there are some foods and substances that you should avoid when taking Cymbalta. There are only a couple of things that you'll want to steer clear of, and you can talk with your doctor about dietary and lifestyle adjustments, or you can ask about alternative antidepressants to try. Cymbalta works by increasing the amount of serotonin in the brain. There are some foods you can add to your diet to help your body maintain higher serotonin levels. Today, I'll cover the main points of interactions you should be aware of before you start taking Cymbalta. I'll also provide a list of foods that can help you naturally boost serotonin levels. You should have a detailed discussion about your risks with a qualified prescribing physician before you start any new psychiatric medication. So, what foods should be avoided while taking Cymbalta? Cymbalta has known interactions with alcohol, tobacco, and ethanol. When taking an antidepressant, it's best to keep your consumption of these substances to a minimum. If it's hard for you to avoid alcohol or tobacco, this is something you should talk about with whoever is providing your medication management. These can have especially adverse effects for people who are taking Cymbalta. Ethanol is sometimes used in small amounts as an additive that enhances flavor and ensures even distribution of food coloring. You may ingest small amounts of ethanol if you eat fermented foods, mincemeat, plum pudding, fruit cake, or foods with vanilla extract. Alcoholic beverages are known to contain more significant amounts of ethanol, so it's most important to avoid them. Grocery items like yogurt, kefir, fruit juices, and packaged breads may also contain trace amounts of ethanol. Ask your prescriber if trace amounts of ethanol are safe for you to consume. The following foods and beverages are likely to contain at least a trace amount of ethanol: wine, beer, and distilled spirits, vanilla extract, brandied fruits, candies with alcoholic fillings, ripe bananas, fruit juices like orange, apple, or grape juice, packaged bakery products such as bread, rolls, or buns, mincemeat, plum pudding or fruit cake, fermented foods like kombucha or sauerkraut, soy sauce, yogurt, kefir, ice cream, and vinegar. So which foods can naturally boost serotonin levels? Certain nutrients can support your brain's production of serotonin naturally. These foods, however, can't produce the same results as serotonin and norepinephrine inhibitors, SNRIs, like Cymbalta. Foods that contain tryptophan, protein, and omega-3 fatty acids are especially helpful in maintaining healthy levels of serotonin. Some of the items on the next list, like tofu and pineapple, may contain ethanol, so talk to your prescriber before adding them to your diet. The following foods contain nutrients that support your brain's production of serotonin: salmon, eggs, cheese, turkey, tofu, pineapples, nuts, oats, and seeds. So what else should I know about taking Cymbalta every day? Cymbalta or duloxetine comes in a delayed release capsule that can be taken with or without food. You should not open the capsule or pour the contents out. If you can't swallow capsules, your doctor may provide some alternative instructions on how you can take it safely. Most people take Cymbalta twice a day, in the mornings and the evenings, but it can cause drowsiness. If you only take Cymbalta once a day and it makes you drowsy, try taking it before bed. Most side effects people experience with antidepressants are mild, and they usually go away within a few weeks. But it's important to know what can put you at higher risk. Discuss your individual risks with the psychiatrist providing your medication management. Let them know about any side effects you notice right away. While you're transitioning to a new medication, you should meet with the medication management provider at least once a week. The first antidepressant you try might not end up being the best one for you. It can take some trial and error to find the right medication or combination of medications. Ultimately, you'll want to balance any risk of side effects with the positive effects of improving your depression or anxiety symptoms. For many of our clients at Lightfully Behavioral Health, medication is an important aspect of treatment. It's always part of a comprehensive treatment plan that's guided by your experiences and your treatment goals. Our precision care model integrates the most effective aspects of proactive and person-centered treatments to create a holistic, personalized plan for long-term mental wellness. You can meet with our residential psychiatrists regularly during any of our intensive treatment programs. Both outpatient programs and residential treatment offer safe environments where you can get help managing side effects as you adjust to your medication. Trying a new antidepressant is a challenge, but the positive effects can be well worth the effort. If you have any questions about how medication fits into our treatment plans at Lightfully, or whenever you're ready to take the first step towards change, feel free to contact us. We'll take the next steps together towards the fullest, brightest version of you.